Hi,
Call the
everyone.
meeting to order at 6:35 p.m. And hello.
All right. Open meeting or virtual meeting statement. Virtual meeting statement. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, chapter 30A, subsection 18, and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. The meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation can be found at www.hubbardstonma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible.
Very good. All right. First item on the agenda is a review of the minutes from 10/27/20. Did everybody get the minutes and have a chance to review them?
They looked fine to me.
Okay. There was one correction I saw under unexpected subjects, just a typo. Kathy will cover. There's the R on the word cover is missing.
Oh. Unexpected.
There's Judy.
I'm just trying to pull them back up again. They looked okay to me when I looked at them earlier.
Yep. So we have one typo and otherwise they look good. Judy, anything from you? Did you take a gander at them?
No, I'm fine with them.
Okay. So I'll make a motion to accept the meeting minutes as written with the one typo correction.
I second it.
All right. All in favor? Colleen, you're at the top of the screen. We'll start with you.
Yes.
Judy?
Yes.
Kathy?
Yes.
And Kate is a yes. All right. So pass. And the next item on the agenda. Let's see. COVID-19 update. So where do you want to start with that, Mallory?
I know we've had a lot of updates since the last time we met. So I attached to the email the 3 new orders that have come out most recently in regards to masks and gathering sizes and updates to all of that, just so you guys can review it. I kind of had Ryan put on social media layman term kind of breakdown of each one and what they all meant. So that was out into the public. I have had a few calls this week in regards to if we're going to be out enforcing and policing people who are taking like their dogs for a walk, kids on bikes, all that good stuff. So I think that we need to probably put together something else for social media that lets people know, like, if you're outside and off your property, you're on public property and you need to have a mask on. I know I drove past the park a few times this week and it was jam-packed basketball games. So I haven't had a chance to chat with the police chief at all to get his feelings on it, but I'm thinking we probably should work something up to get out onto social media just to give a reminder that you have to wear them at all times. So that's pretty much where that is. State has updated the map that comes out every week and how they report the different colors of towns and where the town is sitting as far as red, yellow, and green and gray. And we're currently sitting in gray as of this morning. So we have removed ourselves from the red, which is good. I am going to be attending a webinar in regards to tracing, and that's on Friday. So I'll do that from home.
Cool. So in terms of a statement to put out on social media, what do you guys think? What's the feedback from the members?
Oh, Barry, I sent a copy of the letter from Barry, what they put on their social media. So I think it's just a matter of education.
Yeah. And I don't know how long this order is going to last, if it would be worthwhile asking Parks and Rec to put something on, before you enter into the playground, the park, or the basketball area, that mask must be worn at all times, even if social distancing can take place. But I noticed that there was definitely, on my way home yesterday and the day before, a huge congregation of people on walking the track and basketball and in the skate park. And I know they're looking to put up, I don't know where, but they're looking to put up an ice skating rink. So it's an invitation for.
So were the basketball players not wearing masks?
That nobody was.
Nobody was. Oh,
Yeah, and that was just from my drive by later this evening. But there was quite a few people enjoying the weather. And, I've noticed too, like kids on their bikes, in their little pods. And I'm sure it's the kids that they go to school with, and it's their brothers and sisters and family members. But, if you're out in public, it's pretty clear as day, you must have a mask on, even if you can social distance.
Yeah, I mean, even if we get the people in charge of the park and rec to put up just a sign, even if it's laminated, like it doesn't have to be,
Yeah.
high end or expensive, just to reinforce it.
Yeah. And I'm sure, we're in November, it's going to start getting cold soon. So the activity is definitely going to dip again. But as long as we're having nice weather, people are going to take advantage of it. And
Yep.
There
we
are
don't want to be a hot spot.
there are some brightly colored signs that the state and others have put together. I can download them, print them up, and laminate them, and then we can try and maybe some of that alien tape, we can put it up around.
I think if we just punched holes and maybe zip tied them up,
Yeah,
because I think we have zip ties in the office, and I'm sure Sanda would be totally open to anything we want to do to keep people safe. But
So
I noticed.
that sounds great, Judy. If you would do that, Mallory, if you would let Sandy know, we're going to put up some additional signage because we see too many people not wearing masks.
Definitely.
And in terms of a statement for social media, Kathy, did you want to review the one from Barry and put together a statement on behalf of the board for Ryan to publish, or like a secondary one?
Sure. Yeah, if you want to, is
I
that
can forward that
something
over.
that you sent us, Judy, or?
yeah, I sent it over. And that's the one that they've been putting out over there, so
Yeah, I think Templeton
why
does.
reinvent the wheel,
Definitely. Templeton does a pretty similar one. That's like a weekly report every week they put out.
Yeah.
So maybe that's something we start doing too, is every week, just kind of with the help of Sandy.
Yeah, that's what Barry's doing and Peterson's doing as well.
Yeah.
Every week, something goes out on Friday.
Well,
Yeah,
here
it's-
it would be, we could do it Thursdays. We don't have anybody in the office on Fridays.
Well, the problem is that I guess the map isn't updated
Yeah.
till Friday.
Oh,
I
okay.
can make something. I mean, I have the computer for town here, so I can make something work for Fridays.
Do, I don't see that email from you, Judy. Did you send it just to Mallory or to everybody?
I think you may have just gone to Mallory.
I'll take a peek and forward it over, Kathy.
Okay.
I think I just hit reply and I think it just went to Mallory.
Okie doke. No worries.
Uh,
Just,
Yeah,
I'll get it on its way right now for you.
thanks. And Mallory, could you just use the Hub 2
Yeah.
email for me
Sure.
instead
Oh,
of
sure.
Case Hub?
Yeah. I just don't know who uses what, so I want to make sure.
Yeah,
everyone-
I know. Everything you send me to Case Hub, I just forward to Hub 2 and then delete from
Okay.
Gmail.
I will only use that for you.
And anytime I type in an H, it comes up as Hub 2 because that's how much I send over there.
Yeah, I said that.
And then anything else on the changes to the COVID orders before we move on?
I don't have anything.
Did you guys see the Barry Gazette, the article they had about Hubbardston and COVID?
No.
It's quite long.
What'd they say?
I was gonna say, you want to give us a synopsis?
I
Uh,
actually just bought it yesterday, so I haven't read it yet.
Basically, they said everything that we had on the website and that we had an uptick in cases, which they probably got from the social media statement previously. And just was trying to focus. They didn't give numbers or anything. And they kind of left it at that. It's just,
Well, everybody's seeing an uptick in
oh, I know.
COVID,
They all of
so,
a sudden picked Hubbardston to write an article about.
right, yeah, that seems kind of silly. But,
So-
you know, the cases aren't astronomical, but where I had all my caseload down to 0, now back up to 12. So, yeah, there's a definite uptake.
Yeah, I think it's just gonna be vigilance. It's also, you know, we have kids back in school and everybody gets more sick. We have the, you know, pre-winter cold season kicking in and flu, and everybody, you know, mistakes one for the other. And, you know, I think you get more susceptible in the fall. A lot of people are systemically susceptible to things in the fall because they get the same infections every year, you know.
There
So-
is a problem with testing though, where I'm getting, fielding a lot of complaints from the cases that I'm following, that they're having a hard time trying to get their family members tested. You know, once you have a family member that's positive, then the other family member should be tested,
Mhm.
and they're having a hard time. So right now, you know, the best 2 places for testing seems to be Fitchburg Community Health and Tully Medical out of Athol. So I don't know what, you know, the others have got lines and delays and things like that. And there's been a bit of frustration, and I'm fielding it when I call them, and oh, well, you told me I couldn't do it, you know, et cetera. But they're just having a hard time trying to get the testing. So hopefully, I sent off an email to DPH, and hopefully they'll take a look at it, especially outside of 495 here.
Mhm.
I'm sure it's just going to get worse too with everyone. I've heard a lot of people say that they're going to get tested, you know, a few days before Thanksgiving, so before they sit down, you know, and gather with their families. And then there's going to be an uptick in testing after Thanksgiving, I'm sure. So they're
Yeah.
just going to get inundated.
Yeah.
Yeah, it's kind of interesting. I mean, the last test I had was yesterday, but I went to Newton for mine. And then previous to that, it was Labor Day weekend, the day after I got back from Tennessee. And I didn't really have that much difficulty. I mean, I called my primary and, you know, they happen to be, it's Reliant and Holden. So they just referred me to not Leominster Hospital, the Leominster Reliant. And it was funny because my husband got referred by his doctor to Leominster Hospital, and they're 2 different testing procedures, right? So
Right.
I got poked in the nose and he had to spit in a cup, but it was pretty quick. I wonder if, you know, I know there's an uptick in businesses partnering with labs and getting tests, like, you know, the airlines, for example, are like pushing rapid testing. I wonder if that's also putting a strain on the system and drawing resources away from more rural areas. You know.
Good.
And I mean, short of whatever DPH says, I mean, is there any other alternative in terms of giving people more alternative places to get tested?
Well, they did talk a little bit today about some of the home kits, but again, it's like, you know, you're providing basically a saliva sample, and then you send it in, and then they run the test, which is they're okay with that if they're running a PCR test. The problem with testing is you really need to find a center that does PCR, which is a question that people need to learn to ask, is do you do PCR testing? Because not everybody does. They do antigen testing, which throws you in a whole different category.
Mhm.
So if you come up positive on an antigen, then you got to go back and get the PCR within 48 hours.
Right.
So it's, it's one of those things where you're better off finding a place that's, going to do the PCR for you. Just a piece of information, another piece of education.
And the other thing that just jumped to my mind, I guess Mallory, when you mentioned Thanksgiving, is the change to in the governor's orders relative to gathering sizes in the residence, in a private residence. And I think they're trying to kind of get a jump start on large family gatherings for the holidays.
Yep.
And put a cap on that. So Kathy, maybe that's something you want to reiterate in that public statement
All right, let me make some notes.
to be specific about it, because I mean, I canceled all my holiday plans with my family already. I was like, no, not
Yeah,
this year.
that's what we did. It's just
Yeah,
gonna
they want you just family only, no more than 10, and you have to be related, blood related to one another.
And yeah, I actually just talked to a woman today who's she's in the Chicago area, and her whole family, her husband, his parents, his sisters and brothers, their kids, they were all together and at a wedding, and everybody has it.
Oh my gosh.
So their
That-
kids themselves, his sister, her
Mhm.
family, her brother, their family,
Yep,
like 30 people.
that's what's happening. We're getting entire families. I have two of my cases right now are entire families. One of them went to a wedding.
Mm-hmm.
and that
That's
was some of the cases we had in town too, as a family.
Yeah, that's what happens.
Yep.
And it's like, it's a shame, but people have to kind of stay vigilant with it.
Yep.
All right. Anything else?
Not on that.
All right. So MPH and nursing report. Any updates there?
So we just have one active case right now. We did have another that we thought come in this afternoon, but it turns out they actually moved to Barry. So we're sitting at one as
To
of
me,
sorry. I know Sandy emailed me after we were trying to find the people, and she's like, found them, they moved to Barry, and I kind of did a little yay, and then poor Judy. So we're just sitting at one right now. And I did check in with, like I said, with Sandy to make sure she was holding up, see if there's any support we could give her, and she said she was doing okay right now. So
What was it, 3 weeks ago, there was one that was hospitalized. Did that person do okay?
mhm.
Did they recover?
Mhm.
Do
Yeah.
we know?
Yeah, she's good.
Oh, good. That's what I like to hear.
Yeah, so far we've been lucky and we haven't had any deaths related to COVID. So knock on wood.
Good. All right. Next item on the agenda is failed systems awaiting action.
Nice. So I guess the only one I really have is 10 Main Street, but that's down in the bottom under new business because they submitted for their Title V loan paperwork.
Okay. So passed, failed Title V, again, probably the same one right down the bottom.
Yeah, and I haven't gotten anything new.
And permits and items we voted on, none, nothing there.
Nope, I'm gonna be gearing up to get our annual.
Lost you, Mallory.
Get those permits out or applications out early this year.
So we lost you at the word annual.
Of course. So we usually get the annual like food and tobacco and installers and haulers. We try to get their license out in December, but I'm gonna try to do it a little earlier this year with COVID. I'm finding that our annual safety inspections for building department people are lacking and taking their time, and we're having a hard turnaround time. So I don't want that to happen on our end.
Gotcha.
So that's all I got.
Okay. open repairs, inspections, and plans and review. You want to kick it off from the top and go through them, or Kathy, I'm not sure if you want to run through them.
59 Brigham is almost finished. I'm just waiting for a call to go back for the completion. System is in. My computer froze. Can't see
You
the
want me to-
whole list.
Oh, so then I'll just read them off to you. How about 106 Old Princeton?
Nothing new there.
Nothing.
Okay. 35 Mount Jeff?
House is still not finished.
Okay. 51 Root Road?
I haven't heard anything from them at all.
Nope.
Okay. 68 New Westminster Road?
They have not called.
No, that was the newer one. So I think they were still waiting for their installers availability.
Okay.
Okay. 174 Gardner Road?
That one we just I spoke with the real estate agent who's handling the estate for a mom who lost her son, and they are working on getting us new plans.
Okay. And 106 Gardner Road?
The perk passed.
Yeah, we're just waiting for plans, I think, on that
Yeah, no
one.
plans yet.
Okay. And 18 New Westminster Road?
That would be new construction if it goes through. And that perk passed.
Okay. 39
It's
Williamsville?
a lot up for
Gotcha.
sale, basically.
39 Williamsville?
Have they submitted plans yet?
I don't think so, no.
Yeah, okay. No new plans on that. Perk passed. We're waiting for plans.
2 Cross Street? I'm assuming Crossroad, maybe? 2 Crossroad?
Yeah, Crossroad.
Street. You know what? Did you get anything back from them?
I haven't gotten anything back from them at all, no. I did get stuff back on the Gallant on Crossroad, but not on.
All right. Can you, would you mind sending them another reminder, Mallory?
Yeah,
Thank you.
no worries.
And the last one was what? Is it 87 Crossroad? I don't know if that's
Lot
is that a
80.
typo?
No, it's map and parcel. We don't have a house number yet.
Got it.
So this is going to be a new build. Our Matt approved the plans from Mark Popham. This one's probably going to sit here for a while because she's having a hard time she's building a house for her parents who are in Florida. She's having difficult time with funding from the bank.
Gotcha.
So it's probably going to be at least until spring.
Yeah. Banks are being very slow right now. But they really are. All right. Anything else on that topic?
Yes. I'm scheduled next Monday to do it's 3 lots on Ragged Hill Road. I'm not sure the numbers.
Yeah, I have that one under perks. So
Yep.
you're doing that Monday?
Yes, next Monday, the 16th.
Those were
And there's 3 of them going to be
Yeah,
all in at once.
the town, that's town-owned property.
Oh, sorry. There it is. I'm back. I got the agenda again. Yeah, the parcels have been sold.
Yeah,
correct?
they just sold them to D2 builders. So they're looking to put 3 new houses up there.
Okay.
And
Lot 92 on Morgan Road. I went to the perk, let's see, that was Wednesday the 4th. A fella, it's 25 acres. The young fella's interested in buying it and putting up a small house, and the perk went well. And so that will probably happen in the next 2 years. So that one's going to be open for a while.
Okay. And the last
he
one is
goes through and buys it. 56 Gardner Road. Which one is that? I've lost track. 56. I don't think I've gotten information on that one yet. I
Yeah, that doesn't sound super familiar to me either.
think that's a new one.
Okay.
The housing
And
boom continues.
it's literally insane, Kate. I've never seen anything like this in a town. It's, and I had the two real estate agents come up to me today and say that there have some going in, and we had an A&R in the planning board that created 4 new lots. So I'm sure those will be scooped up fast. It's nuts. I guess everyone's coming from the city.
Mm-hmm. Yep. I've heard, I have plenty of people I can tell you who are moving from New York, New Jersey to New Hampshire or Massachusetts, and they're moving to rural New Hampshire and rural Massachusetts.
Yeah.
Yes, definitely.
Because rural New York and rural Vermont are already soaked up and expensive for them. That's why.
Mhm. Yeah. That's what actually the real
Massachusetts
estate
is cheaper.
Yeah.
cheaper than New York City.
Mhm.
Wow.
Yep.
We'll
Well,
be getting
I
a
know
ton
there's a
of
whole new developments going over in Rutland too. They're building like crazy right now again.
so we'll get an influx of people from the city, and then next year we'll get an influx of chicken complaints because people will have their chickens wandering and pecking gardens and
Only had 2 of those this year.
Yep. It'll be a little adjustment. That'll be okay. Little green acres going on.
Yeah,
All right. So moving on to parks, or we did all the parks. We're
we
done
did
there.
all of them.
All right. Moving on to open complaints.
So 248 Garden Road. Judy, have you had a chance to go out there at all?
Yeah, I was up there last weekend, and they had pushed a lot of stuff from the center. I get they cleared out the burnt logs and all that, but then they also pushed a lot of stuff to the edges. So I've been following it every week. I go up there, Dennis and I go up there because he's got the Jeep, and so we go up there. That road is ridiculous trying to get up there. But we go up that access that road. He won't let me take my brand new Kia. I don't understand that. But anyway, so we go up there using the Jeep and check on it on a weekly basis. I'm going to have to stop by and actually sit down and have a one-on-one talk with them and just find out what their plan is. I've been trying to count cars as well and things like that. So yeah, I've been following it. I'm just trying to formulate some sort of plan in my head as to
Hard.
how to approach all that. But I've been taking pictures every week too, so.
Good. Judy doing the off-roading in the Jeep.
Yeah.
I just keep thinking, did you watch The Crown? Because I picture you like with your corgi in the Jeep, like the queen, right? Being like driven up the mountain.
Yeah.
All right. And the next one is also on Gardner Road, the
Yeah.
111.
Yep. So actually the homeowners called me on Thursday to let me know that they did have a dumpster coming this week so that they can do cleanup this weekend. And I've been driving by and they have made quite a bit of progress. There was no dumpster yet, but they're probably getting it later in the week because he said that they both work 7 days a week and it's been really difficult. So this is the first free time they've had. So they're going to work on getting that cleanup done. But I drove by this afternoon and they've even made progress without it. So
Good.
the couch is still there, but he told me that will be put in the dumpster.
And the pickup truck full of trash too.
Yep, that's going to go in the dumpster. I did tell him that was our concerns, storing it like that. And so
Very good.
Great.
hopefully Monday we'll see a big improvement.
All right. So I'll follow up in the next meeting.
Yep.
All right. New business. Title V loan request for 19 Mount Jeff.
So I actually spoke with Lynn. She had told me she was ready to go. She had chosen her installer. She called this morning or yesterday and advised that she's not sure that she wants to go through them now. She has sold her house. And she just asked that this get put on hold until she decides who she wants to utilize as an installer. So I told her these need to be voted on at meetings. Our next meeting won't be 2 weeks after. So this is still on hold. And I don't know if she's going to try to escrow now that she is selling the house, but there's nothing in the loan program that says you can't borrow the money and then not pay it back right away. We've actually had that happen in other towns I've worked in. So it's on hold, but the people who have put an offer in on our house have a Fannie Mae loan, so it needs to be fixed before anything's legal.
Yeah, before it'll even close, right?
Yeah, so it's on hold on her end, and it's, she's trying to get another estimate from a 4th or 5th installer. Everyone's just so booked out
Mhm.
that nobody has availability right away.
Right. Well, and with the time crunch with the ground starting to
Things are
freeze
getting
soon,
cold.
right?
Yeah. Yep. Fortunately, this can happen. Title V can go on all year round, but not every installer is willing to do it in the winter time.
Yeah.
So, no, don't blame them. I don't like being cold.
Yeah. And also it's really tough on the equipment.
Yeah.
And it's a higher cost for them, but they don't really charge that much more for, when the ground is harder and just wear and tear.
Right.
Yeah. Okay. And 10 Main Street, another.
Yeah. So I sent over to everyone the Title V loan paperwork for 10 Main Street. So I don't know if you had a chance to review it. Taxes are all set. They're good to go there. They have approved plans from Mark Popham that Jen Susan Roy approved. I sent them over to Matt to just kind of take a peek. And, even though he wasn't the engineer who approved them, he said they look good to him. So their cost of installation was $53,000. They're looking to use AMC Services and Jeremy Kelly. They are going to supply the first 13, or looking to supply the first $13,000 for the installation out of pocket. So they're looking to borrow $40,000 from the Board of Health. So basically what needs to happen is the Board of Health needs to take a vote on this. And I sent over kind of the procedure on how to handle the loan. But once we vote, it then goes to Sandy over the treasurer collector. She does all of the legal paperwork and takes care of cutting the checks. The checks go over kind of just like our regular vendor warrants do. And it goes from there. It gets put onto their tax bill and they pay this back when they pay their annual taxes, property taxes at 5%. And 5% goes into the general fund. Did I cut out?
No, you did not
No.
cut out.
Good. Everyone was kind of frozen. I was like, oh, that was a lot of words.
And then, so they do have an installer chosen. They have a plan
Yeah.
submitted.
Yep, the plan was submitted and approved prior. So the plans were approved prior to them purchasing the house. So those plans can transfer. A lot of
Okay.
times when people like sell lots or whatever, they transfer their plans. So that's totally fine as long as the installer follows those plans. And these installers have agreed to. So we currently have about $150,000 in that account.
Gotcha. All right. So has the board, everybody read the attachment relative to the loan application? Have any questions about it? Don't all answer at once.
I understand.
Bueller.
And the specific information that you just told us, Mallory, that's not included, is it?
I'm sorry, what was that?
The specific information for 10 Main Street is not in our attachments, is it?
Yep, I put in everything except for the plan because I can't scan that in with the equipment we have. So everything, all 3 of our estimates are there. It went in over with all the other meeting documents. There was like a email with 8 attachments.
Yeah, somewhere I'm not seeing it. I'll keep looking.
So they put their estimate from AMC in there, and there was one from Elaine Siteworks.
All right, it didn't come through on my Ladybug thing. I will keep looking here.
Yeah,
Do you want to let me share screen, Mallory? and I
yeah,
can-
absolutely. Hold on one second. Get my email panelists.
Oh,
Oh, wait a minute.
Did you find it?
Hold on.
Yeah, there's a
Hold on.
lot.
Oh, yeah, got it.
okay.
One more, sorry. Took a while to find it.
So Sandy and I have actually been brushing up on the Title V loan program because we had someone pay off their loan recently, and we had to do like the releasing of the deed and all that good stuff to prove that. And it looks like in the past it wasn't always recorded or collected correctly, so we made sure that we're all good to go on that, so that doesn't happen in the future. But I know the
Okay.
state definitely encourages the use of the program if we have the funds, and we haven't issued any in quite some time. So
Okay. Well, quick review of the documents look fine to me, and I make a motion that we approve septic loan request for 10 Main Street in the amount of, they wanted 40,000, correct?
Mallory may have cut out.
Yeah, that's what it said, I believe.
Yeah.
So
I'm just
I'll
gonna-
second that motion.
Oh, yeah, there it is. I see it, in $40,000.
Ben is second. And Colleen, we'll start with you since you're at the top of the screen.
Yes.
Judy?
Yep.
Kathy?
Yes.
Ben?
Yes,
And Kate is a yes.
great, that'll make her very happy, and that will be an agenda item we can hopefully remove from our our list soon.
Yep. You can check one of the boxes on the checklist on the last page. You'll be all good.
Yep.
All right. Moving on to health inspector and MPHN.
Perfect. So I forwarded over, Kathy had started a ad to put out for a local inspector to help with the Title V inspections. And then I kind of just put in my own words. And so I sent a copy of both of those. And then Ryan actually emailed and wanted us to kind of open the dialogue up again about MPHN and hiring them to do our inspectional services, to figure out which route we want. I know it's something we've talked about the last few meetings, but we haven't come up with a plan or how we want to proceed. We haven't voted on anything. So we just kind of put it there so we can open up the dialogue again to see if we want to move forward with MPHN or if we want to move forward with hiring an inspector, and if the ad was okay, if we wanted to add or take anything away, or where we're going with that.
Gotcha.
So the reason I'm moving forward on this is because of the huge number of
Yeah,
sites that are open and going on, and it just takes so much time. So I like what you generalized. Is Title V system inspector the versus a sanitarian? I'm confused in the verbiage of the title of the position.
sure. So a registered sanitarian is a little bit different than just a system inspector.
Okay.
So you can inspect systems without having all of the qualifications of being a registered sanitarian. We just want to make sure that whoever we hire has completed the new EPAC course and passed the test and is still licensed with, keeps up all their credits and stuff with new EPAC. So I know before you become a registered sanitarian, you have to have like X amount of experience and stuff too. So this might be a way to get someone who's qualified that experience as well.
So
Yeah, sanitarian is professionally licensed, while the other one is a certification. so.
Right.
And so before we even talk about the role potentially, I think we need to discuss the route we're gonna go and to make a decision, and then given that route, then find the role, right? So the choices on the table seem to be we either, put out a rec to try to hire a sanitation expert, or we go with the regional services through MPHN.
I'm
Is it-
still a little skeptical about going with that network. Because I haven't seen anything that shows that they have a good track record. So, I mean, have they provided information as to how many of the inspectors they do have and what towns they're actually working in? And, have they provided any of that information? I mean, what is their, how extensive is their, I mean, they're fairly new. I mean, this is a fairly new network, and it's not like you're talking to Shoba here. They're fairly new, and so the question is, just how solid are they?
I don't really know. I think so here's the thing, regardless of whether we go with a network or we go with an individual, what are the skills, qualifications, and thresholds we're looking for? Because ultimately, we should ask the same questions of either,
Right.
right?
I think what's attractive about going to a network that handles all type of inspectional services is that we're going to have someone who's food certified in case there ever comes a time where we don't have people who can do our food inspections. We're going to have someone who's lead safe certified, which we don't have right now. We're going to have someone who can handle housing from start to finish, and same with septic. In case anything ever happened, we have people or a network. And I don't want it to fall back upon. I don't want to say like it's not our problem, but they have to help us provide us with that service. And they're not experts, but they all have their certifications that they would provide. So that's, I think if we were to hire a single person, it would be cool if they had all those qualifications as well. I know Jen Susan Roy had some of them when we hired her to help with health and septic or food and septic, but it would be kind of neat just to have the whole package.
I have a question about that. If we hired the whole package, would that include the replacement of Matt Hopkinson for our review person?
I know MPHN offers like nuts to bolts, like start to finish reviews. So there's potential. If we hired just an agent, then Matt could probably still do our reviews. I know he's planning on retiring, he said, and at our, he did say that if we plan on using him within the next year, that we would have to look at digitalizing everything because he is going to be in Maine most of his time. And right now, when we get a new plan, he comes into the office and he picks it up and then he drops it off with his notes and his review comments on it. And he's not gonna be able to do that.
Well, and the reason I asked that question is because I would not be in favor of replacing Matt until he decided he would like to retire. That would be his option, but I think he served this town very well. And I think his services are coming with the plus of being a resident that takes care of it. Much
Yeah,
more so than I think a third party would. So if we could do the in the field type of inspections with a third party and then bring them back home to what we've done for so long, that would be my choice. And digitizing, as I understand from Ryan, it's going to eventually come along. So I think maybe this will accelerate the program. We should be doing it, of course, but.
Right. So we're gonna have someone come in to do. We would need like a plan scanner, or I'm sure that we could ask engineers just to send over electronic copies too. But we are having someone come in and digitize all of our records, which would eventually, which would be cool, because then the public would have access to all the public record in a portal.
So, you know, what I'm hearing in terms of pros and cons, like an individual versus a network, is really more coverage and more service availability and less of a single point of failure. And Vin, I agree with you. I think that Matt's done a good job, and that having either one of these people and or services in place doesn't preclude us from using Matt independently,
Right.
which would be fine. But he has mentioned to the board that he's like, oh, you know, I'd be fine to just not do this too. So at his leisure, but I'm sure he's planning it.
Would he have any recommendations for a substitute or another organization to take over? He's been in the field a long time.
Yeah, I can ask him. I know I've been contacted by Tim Newton, who does Greenfield and he does New Salem. And he said that, you know, he'd definitely be interested if we needed someone. He has all the certifications. So I told him that I'd let him keep him updated on progress, and that if we opened the job up or opened a job up, I'd let him know so he can take a look at what we have. So we have people who are qualified and interested.
My take on this is I'd like to get someone sooner versus later. I'd like to, as Judy suggested, is, you know, MPH is newer type business. I'd like to get some statistics from them as to the number of people they have involved in Title V inspections. Therefore, before we commit to a 1-year contract with a big organization, I guess I'd like to go private first and get someone on board, put an ad out now. I think we'll get 2 or 3 people who are looking for this kind of work on a part-time basis, and therefore I'm worried about them being timely enough, because I think that's one of the things that I've been able to improve on for the department this year, is that I'm timely on getting the perks done, the photographs and checkups on the bed bottoms, and when the system is laid out, and then the completions. I don't think I've held up anything this year for that type of follow-up. And I'd like to be able to have our Board of Health maintain that record. We weren't like that a couple years ago, and I'd like to have that continue.
Gotcha. There's I mean, although that said, there's no, I mean, I don't see an issue with getting stats at all. I think that there's no way to guarantee going with an individual or a network that we're not going to introduce delay. A lot of it's going to depend on that person's schedule, how many other towns they're serving. If somebody's part-time, it might not be their full-time job. There can be conflicts. So I think there's probably some room for that on either side of the coin.
Okay.
Right. And Judy, what is your criteria for a network like this in terms of success? Like what's an earmarker for knowing that it's a successful network and somebody we would want to work with?
Well, we haven't really heard too much about it. I mean, mostly I know that they offer nursing services. Beyond that, I know nothing. So I don't really I have nothing to base a decision on. So I don't know how many towns they're working with. I don't know how many perks they do every week. Do they have somebody dedicated just to that? Do they have, what kind of services do they offer? And so, I mean, I don't have anything to base a decision on at this point. I know somebody over in Rutland that also does, perks and, he may be interested in coming over and helping us out, as Kathy said, maybe staying on the private end for another year. I don't know. I like I said, I just don't have any information to base a decision on. So I just wanted to see something a little more concrete.
And then guess two of my question is, are we going to be hiring just for septic, or is this going to be someone who kind of is going to encompass all the Board of Health needs?
Kathy, what was your thoughts on
I
that?
guess right now I'm looking for help. So am I worried about all the health needs right this minute? No. Do we need to plan for that in the future? Yes. But I don't, I don't want to take, Jen has a vision. Look at that list and it's all still open. I'd like to have some help sooner versus later. And if I'm still involved, then I'd like to be able to work with the same person. And I'm wondering if you get a larger organization, if you end up trying to work with several people.
Yeah, and I'm not sure we know. I think that's part of one of the questions.
Yeah.
Um,
So
is
I'm
there
just-
is there a
that's why I'm
cost?
kind of saying, let's put an advertisement out
Mhm.
and get some help and look at the overall thing for long term, like you're talking about. And but I'd like more help now.
So if we go the route of a
Some of these are
sanitarian,
already open. I've already done part of the work,
Mhm. What's the cost differential between hiring a sanitarian based on how it's outlined versus what MPHN pricing is currently?
There's this,
Versus somebody that's certified for your certification versus your sanitarian versus your organization. Yeah. Don't
Well,
have,
I mean, the organization may have a sanitarian that's assigned to do the same work. We don't know that.
They
So
do. They do everything from plan review to inspections and all
So
the
what I'm saying is if all things are equal, so I'm looking at the outline, the mail attachment that was sent for the sanitarian with the high level kind of elements, right, that are needed for the requisition to go out and, hire somebody. If it's a 12-month contract and it's going to be re-reviewed, I'm fine with that. My question becomes if it's, how is it structured? So I'm reading this and it says inspections 1 to 2 hours, $75. So is that $75 for each of the first 2 hours? Or is it $75 for up to 2 hours?
should be up to 2 hours.
Okay. And then after 2 hours, it'll be $35 an hour. And is that
Yep.
competitive with or in line with the same cost from MPHN? I don't recall. I remember we looked at them
Sure.
like meeting ago.
MPHN was $1,000 buy-in.
Mm-hmm.
And then I think it was $50 an hour. And then once you use up that $1,000, that's when you start getting billed hourly. Just like with our nursing services, we pay in, and once we use up all that hourly, then we start the hourly with the first initial pay, and then we start getting charged hourly for the nurses' services.
Gotcha. So it'd be what, $37.50 an hour for the first 2 hours
Yeah.
with the sanitarian. I have a hard time with that word.
And I would just say system inspector.
Then 35. So the hourly cost is less. It'll be ad hoc. Will it be set hours? Will it be a minimum number of hours a month? Does anybody
Right.
have any feeling about that?
And you think you have to make it kind of attractive. A lot of people who are qualified are probably making a little bit more than that right now, working in their their other jobs.
Yeah, MBHN actually has an opening for their,
Mhm.
they have an opening for a person with a similar qualification, and it's 68,000 a year.
Mhm. So, and also with purchasing into MPHN, we're not just paying for a system inspector, we're also paying for someone who can do the food inspections and do any housing inspections
Mhm.
and lead inspections if we ever get a lead complaint, and all that good stuff. So we would have to factor, I know that right now you guys are volunteering to do the food inspections.
Yep.
That would be something they could also handle.
So,
For my
go ahead.
information on this is, I've been on many perk tests over the years where there's been a Board of Health representative witnessing the perks, and also where there has been an outside agency witnessing the perks. And the outside agencies have a tendency to hire somebody to go out there and just take down the information that the engineer and or whomever is monitoring it tells them to take down. And a representative from the Board of Health and or an engineer that's there from the boards of health seem to have a little bit more awareness of what really is going on with perk tests. So I could think I would opt for somebody individually that would be responsible to the Board of Health and not necessarily to their employer that would be responsible to the Board of Health. You know, that chain of command type of thing. I've seen it be more effective when there's somebody there that's knowledgeable and has some type of authority over a perk test, as opposed to somebody who's just there to take down the notes that they're given. Because there are things that can happen on perk tests that sometimes is not in the best interest of public health.
Mhm. Understood. Yeah, I mean, I think an individual being responsible to the Board of Health is more attractive from that perspective. Although I've seen it on either side, because I've definitely seen where, you know, boards of health have showed up and done inspections and it shouldn't have passed. So I've seen both sides of that. But I definitely agree with you on the fact that an individual being responsible to the board would be beneficial. If nothing else, it would give us time to start moving our processes over to using a third party. And if it's a 1-year
Yes.
contract,
Right.
then at the end of the year, it can be reviewed. And if it's working, continue. And if it's not, look at a network service. And, you know, we can kind of continue gathering information on MPHN and other networks, the regional to us, to see if it's something we want to do. But everybody,
Thank you. That's kind of where that's where I'm sitting.
yeah.
And
Oh,
the
so are we
first
all
one-
talked out on it? Do we want to maybe formulate a motion? What do you think? Oh, I'm sorry, Kathy, I can't hear you.
So, my motion would be to advertise for a Title V system inspector, which is the way Mallory wrote it. And some of what I wrote was more like, we can also, before I make the full motion, request, what do they get paid by the other agencies that they work for, if they do? And if it has to be more than $75 for the first 2 hours, we might have to accommodate that. But
Wouldn't the fee be paid by the people doing the perks?
right. So, and that's another option too.
So we charge 205 for a perk test. So we have that in our fees.
Right.
And then it's 205 for an application for installation.
So it should cover it,
Yep,
unless
it
there's
should cover it. Thank you.
unless there's ongoing issues.
Yep. So I make a motion that we move forward to advertise for a Title V system inspector as written by the second part of that page, that Mallory, more general advertisement. And that's my motion, I guess.
Well, before I second that, Kathy, couldn't we also just advertise for someone that also could do food inspections as well, just to have them on the back pocket, so if we need them? I mean, there's nothing that says we can't advertise for somebody with all these qualifications that we want. And if we get one individual that's able to help out, well, we get a bingo. If we don't, well, then we can at least have somebody do perk tests. So.
But I've had a couple of people kind of come to me and ask, because I know, Kathy, you are speaking to some of the installers and looking to see if they had any recommendations. So word got around. I had another town Board of Health agent come forward too. So the people that I've had 2 agents come forward, so they would have all the qualifications to do Title V and food, which seems to be where the interest is coming from, as people who are qualified for both.
Okay, I'm willing to modify the motion to include that the inspector be able to do food inspections as well.
Okay.
I'll second it.
All right, we'll take a vote. Colleen,
Yes.
all right. Judy,
Yes.
Vin,
Yes.
Kathy,
Yes,
and Kate is a yes.
thank you, folks. Get started and see where it goes. Can review things maybe by the next meeting or the one after that.
Yeah, I'll get this over to Ryan to get advertised for us.
Okey doke. And moving on to old business. Food inspections. We did one. We got another one done.
Yay!
I don't even remember where it
Rieta
was.
is- we did Rieta.
Okay, thanks. And by the way, Rieta's spotlessly clean. Just
Was it good?
so good.
Great.
I was like, damn, this place is perfectly clean.
That's awesome.
Yeah, really, really well run kitchen, good processes. Everybody, yeah, it was good.
I was really impressed with how they handled and conducting themselves this season, especially with COVID. It could have been the perfect recipe for disaster, and seems like it was just flawless. I mean, sure there was issues, but
Yeah.
not what I anticipated, which is great.
And John did ask that we keep in touch in the springtime as COVID regulations shift and change, and they start their planning for reopening.
They would like to open in April.
Ooh, great.
So all good stuff.
Great.
And then there's a couple still open. I'm off the next 2 weeks. If I'm feeling okay next week after my surgery, Kathy, I'll reach out and we can tackle 1 or 2 if you have time.
Yep.
If not, maybe the week of Thanksgiving. I don't know. It's going to depend on how we feel.
I don't know. So I don't know why, but Hubbardston schools look like they're closed the week of Thanksgiving. So I don't know if you'll have access to the kitchen that week or
I
not.
know. Well, yeah, I was thinking
We're
sometimes
hopefully going to get there next week sometime.
yeah,
Okay.
I was hoping for next week, but I'm also hoping I'll be able to stand up without passing out. So we'll see how that goes.
Fingers crossed.
Fingers crossed. All right, moving on to the budget spreadsheet.
So we haven't had much. Just I paid the invoice that we approved for Robert Meager for mowing the landfill. Nothing else is coming.
And the EDS. Oh, sorry. Go ahead.
Go ahead. The only other thing, Mallory, would you start including what our deposits are?
Okay.
From all these incoming
Yeah.
perks and things?
Yeah.
Just so we can see the finance that are coming in. Would you add that part to the
Yeah.
budget? And Thanks. That'd be helpful for when I try and look at the monthly or quarterly statements,
Sure.
because all that budget stuff is not my cup of tea per se. I'll do it if I have to do it.
Gotcha.
And just helps to know how much we have taken in each month,
Absolutely.
turned in. So, okay, thanks.
And then the last item is, before we go to unexpected, is the EDS plan.
You sent over the newest attachment. So I forwarded that over. I'm not sure if everyone had a chance to review it.
I reviewed it. I didn't.
You did?
I did.
I reviewed it too. I reviewed it also.
Yeah.
It's a lot. You know what? I'm going to tell you what. I reviewed this and it's overwhelming. No, well, not to me, but to the casual person that sits down and reads this, that, you know, if we have a disaster and you hand them this, this is not going to, I mean, I love how it's written. It's written really well, but needs to be broken down into small sections for certain disasters. And I think, Judy, weren't we doing that in the CERT team years ago
Yeah.
before I left? And then
Yeah, for emergency management, we were going scenario by scenario.
it's got to be that way, because it's 166 pages of
Exactly.
just I looked it over and I said, oh, this is great. Yep, this is good. This is good. But for somebody, if you're going to have somebody actually come in, if say we had a big disaster here and you have people come in, and I know you're not going to hand them this whole pamphlet, but it needs to be broken down into real simple stuff. And we've talked about that years ago, but it looks good. But I think it needs to be like the resources and the staffing for each incident, and in just how can I say this? Just in simple line by line, this is what you're going to do, and take out stuff that they probably wouldn't do for each disaster. Do you know what I mean?
Well, it's only for one disaster.
Well, I
And-
understand.
and That's infectious disease, so.
But it's only for one disaster, but you've got a ton of medical stuff. Then you got logistics, and then you have planning, and then it comes down, each thing, and it's just a lot of words. It's a lot of pages. It's a lot of stuff.
And when I first started, it was almost double that.
Yeah.
When I
It's,
first
no,
started,
I mean, it's obvious you've
Yeah,
done a lot of work on it.
I just trying to put it in some semblance of order.
Well, it is. And I went through each one and I thought, this is really good, because, I've seen how this could all work out many times, but you're talking about a little town with people, and then you'd have no idea who's going to come and say, I'm going to volunteer. I'm going to come. I want to help you. And the disaster's already happened. So, I mean, looking at this, it's like, geez, we could be creating another disaster if we don't really bring it down to simple terms. And also, who exactly is going to be doing all these jobs?
The Board of Health.
Us.
Well,
Yeah.
Board of
yep.
Health.
It says in some of these that this is who you could possibly have work with these, do these jobs. And it names off a bunch of agencies and people and types
So
of.
I think if we, there's definitely potential for this being like in the spur of the moment, we need to hold an inoculation clinic for, someone who was exposed to something at one of our restaurants. Like when we did our EDS drill last year in December, I think we used the restaurant example, right? Was that it?
Yeah, hepatitis A.
Yeah, I think
Yeah.
that's what we did. That was our drill. But I think too that we really need to kind of focus and zone in on this for what's upcoming. Realistically, we're going to be holding this drill or site. I'm sorry. We're going to have COVID, vaccine. So I think it's not going to be spur of the moment. We'll have time to get these agencies together, right, Judy? We'll have some
Yeah.
time.
Right, Judy?
Yeah, we have to March.
I know. I read that they're expecting it to be, enough for the United States by March, April. So it's
Yeah. The deliverable to the DPH is that the Board of Health has to have a plan in place this year.
right.
So, so we have to have some sort of plan. And I totally agree with you that document, like I started and it was like twice the number of pages and they had quote hyperlinks and, it was nuts. So, so I understand your point, Colleen, and yeah, it could be a lot simpler. I'm not sure how to go back. I'd have to look at it all over again, but yeah, we could probably boil it down even more.
I mean, think about this. We're going to give out vaccines. So you're going to go to the EOC, which I'm assuming is the gym at the center school.
Yep.
No,
Mhm.
EOC is if you have such a massive infection or you're going to have an EOC that's also going to be working with you. So you're going to have emergency management working with the Board of Health, but the Board of Health will end up being the lead agency. But really,
No, but-
what we need
But
to
where's the EOC? Where's the emergency operating? Where are we going to be working?
what we really need to concentrate on is actually just running the clinic, and we're going to be
Right.
operating out of the gym. And I think that's the piece. I mean, we can have this elaborate plan and try to cover all bases, but
It's really
know,
going to
the-
be a small thing.
well, I don't know, trying to get 4,800 people vaccinated isn't going to be a small thing, but
No, I know, but I mean, you don't need all of this that's in this plan to do what we have to do here in our little
Correct.
town.
correct. This is everything, including the kitchen sink.
Yes. And we don't have one over there. No, just kidding. No, but so maybe we could just like slim this down to just that.
Well, you know what you could do is you could pull out some of the quick checklists and create that as your on the go kind of manual. So you could have this
Right.
one back there. You could have this whole schmo here back at the office. But then you could have a smaller guide that we can just pull some of those checklists that are
Yeah.
Right, exactly.
That's what I
Exactly.
was thinking, because you remember how we did our drill and they handed us each a packet and all of our
Yes.
information was in that packet. I think if we had, if it was a binder, if it was a laminated, clipped together, something, if we could hand each person at their designated stations their pertinent documentation, it would make things a lot smoother than trying to carry
Right.
around this binder.
But we may want to
Oh, yeah.
adopt this as the master and then
Right.
actually
And then
go
work
through
out
the
of it.
exercise of pulling out the pieces and walking
Right.
through what that would look like for rolling out COVID vaccines. If they
Right.
become mandated and mandatory, we're going to end up there, right?
Absolutely.
So
Yeah. Well, I mean, we'd be crazy to think that, oh, it's not going to happen, because we know it's going to happen. They're going to have the vaccine, and then they're going to. I can't imagine that they're going to have like everybody go to a hospital to have this done, because you'd have to do it from town to town. It'd just be ridiculous to
mhm.
think
Well,
that hundreds and hundreds of people are going to go to one building
and,
far as
yeah,
I
I
know.
in
know.
Leominster. You know what I mean?
Right,
And just
right.
have different towns. And I mean, so I think that to just have our little cheat sheet for Hubbardston to pull it out of here and just have it for us, and do that with all of our disaster stuff, not just this. And I think, Judy, I think that's what we were trying to do years ago,
Yeah.
but not for vaccines. It was for other stuff. This is different. So that's just that was just my opinion.
Colleen, there is a notebook, I believe, where you did some of those cheat sheets that's in one of the files in the Board of Health from the past. And this
You mean from what we did
document, very
last year?
complete, Judy, it looks very nicely organized. Thank you. That's awesome. Well,
Yep.
what this document is in the order that it's in now is easy to follow very quickly. But yes, Colleen, we do need our little cheat sheet packets, which we should be working on in the future. From this document, I think we should just go ahead and accept this document. It looks complete. I don't see errors in it.
It looks great.
Yeah.
It looks really good.
Yep. You did a good job, Judy, in putting the organization to it in a logical way. Thank you
Yep.
so much.
The only question I had for everybody was like, when it's stuck in the middle of it all, was this alternate policy and plan for a drive-through.
I saw that. Yeah.
I didn't know what to do with that. So do you want to just like discard it, or do you want to just tuck it away somewhere in an envelope and or I don't know. I didn't know what to do with it. I don't even know why it was there. All of a sudden in the middle of the whole document
Right.
was this alternate plan for a drive-through EDS. And they
I
already
think-
had a plan in there.
For a drive-through. Yeah.
Right.
So I think maybe make the alternate plan an addendum and just put it at the bottom and keep the primary drive-through in there.
Yep. That's
We don't
what I
allow
did.
drive-throughs in Hubbardston.
But, I gotta say, the drive-through COVID testing is very efficient. And now I've done 2 different kinds, right? I've done drive-through spit, drive-through nose poke, and then a walk-in nose poke. And the drive-through at Leominster Hospital with and actually Reliant too. Same kind of procedure as what's outlined. It was very efficient and it worked. I think that it could work, because I think part of the issue is going to be something like this. So let's say we go down this path and we have an open vaccination clinic for COVID because it becomes mandatory, and we have to go through and find time slots to have people come through, because we can't have too many people in one place for risk of infection. Drive-throughs become pretty convenient to separate people and to keep them within their family unit. So I think it's worthwhile. I just think that it'll be very difficult to track everybody. It would be very difficult to have everybody come into a building because there are going to be people who have mobility issues and other things that, impact their ability. It would be really interesting, I think, for us to adopt a drive-through mentality if we end up having to do this.
Well, I've done both in the last couple weeks, and the drive-through, the one lesson I learned was you really have to make sure you have a team for the driver's side and a team on the passenger side. So if you're giving shots, you got a nurse on one side and a nurse on the other. If you're doing screening, you got one person on one side, one person on the other. So if you're gonna do a drive-through, just remember you have to double up on your teams. On the other hand, the walk-in clinic can be done. You can spread it out all over the place, and people are really, really good. My screener was mentioning how everybody waited outside the door until she had finished screening and done the temperature check and all that, and then they had moved on to the next station. So people were very, very good about just following the rules, or following rules that nobody had even told them to follow. So people are pretty good about that. I don't think we'd have that kind of problem. They had security there and didn't need it. So
Well, that was the other thing I saw in here too. This the security staff. and it said, who was going to do security, and I'm there. It just didn't say, and I thought, I don't think we should be doing security. I think
No,
we'd be
that's-
pretty busy doing other stuff, but
That would be,
there was no answer to that in there.
that would be the police.
That's what I would assume, but yeah.
Okay. So
Okay,
do we want to adopt this as written and then go about planning for a smaller, focused approach?
I'm
I-
good for
Solve
that.
both
Yeah.
problems.
I got 3 people at once, I'm sorry.
Yeah, no.
I said that would solve both problems and it makes sense. We don't disregard what Judy has done. It's a massive undertaking, but we also need something that's going to guide in the field as quickly and as efficiently as possible. So
And
We need
that's
a brochure
doable.
version. Good. All right. Kathy, you were starting to make a motion. Do you want to?
So I want to make a motion that we approve the Hubbardston EDS Plan 2020. Is that prepared? It's by Judy. And with the alternative drive-through plan as an addendum.
That sounds good. Yeah, I'll
Is that-
second it.
All right. Colleen is a second. Vin, we'll start with you.
yes,
Colleen,
Yes,
Judy,
Yes, and thank you.
and
good
thank
job.
you.
so
Kathy,
thank you, Judy.
Yes, and Judy, hugs to you for doing all that.
and Kate's also a yes.
So I'll get the page numbers and straighten out the table of contents and put it in a 3-ring binder and start. And then I'll have Colleen.
I was gonna say, if you
And
want, I can sit
it-
down with you and we can do this.
Yeah, we can pull out what we want.
If you, I
the-
mean, I'm sure this was a massive undertaking in what it was. I mean, it's great, but I didn't know, I can certainly help you with this.
Okay,
All right. Do we have any unexpected subjects?
Yeah, I actually have 2 of them. So I sent over the Council on Aging would like to hold an in-person meeting. They have 9 members in their board. So if anyone shows up and all members attend, if Claudia is there, because I know she usually attends, that's maxing out the 10-person indoor limit. They don't like meeting on Zoom. A lot of them have connection issues or hard time getting on. So they want the Board of Health blessing to hold an in-person meeting on Friday. They have things to discuss, like I know Claudia's mentioned their holiday fair where they do a lot of gift baskets and stuff like that. And they're trying to figure out their game plan for the rest of the year, I guess. So they do need a meeting, but they're not sure if they'll have a quorum or if people will be able to participate via Zoom. So we did get the meeting posted. So they have enough time to, with it posting, because it has to be posted for 48 hours. We have it posted for in person right now, but the clerk said she can change it for virtual if the Board of Health doesn't agree for in-person meeting.
Gotcha.
So
Can they
my
make Can they
biggest
meet
thing-
at a gym or something where there's more space?
they meet in the COA room. So the gym's being utilized because it's during school hours and Hubbardston's in school full time. And they meet pretty early in the morning.
It's pretty risky.
It's very risky. If they have anyone show up outside of their members and their, Claudia, then the meeting is going to be shut down anyway because they'll be over the 10-person maximum.
well, they just shouldn't let anybody come in, period. I mean, lock the door and tell them that they're not.
They can't do
they're-
that for a public meeting though. You have to allow members of the public to participate.
I think they have to do what we do, which I don't. I prefer not to be doing Zoom either, but I think they have to be a Zoom meeting.
I was
I-
under, I thought this was like their board of directors or whatever, not that it wasn't an open COA meeting.
Yeah, so they haven't had a
So-
council on aging meeting in
So
quite
this
some
is more
time.
open.
Oh yeah,
this-
yeah. This is their normal, like how we meet. This is how they're looking to meet.
Well, there's a difference between having, you know, your officers meet and opening it to everybody. I mean,
Right.
I know my organization, I have the officers, they come over and we eat pizza, but, you know, and get on with the business, but I'm certainly not going to open the door to everybody.
Right.
Um,
No, this is they're looking, I'm just looking at their agenda right now. They're looking to introduce a new board member. They're looking to do some stuff with the treasurer, Christmas fair, go over the regulations that pertain to them concerning COVID and their opening and future plans and programs.
Toss it to the Board of Health.
So this is definitely a public meeting and anyone
Okay.
has the right to attend.
Does it
Well,
have to be
in
this
that
week?
case, I'm not in favor of it.
Hmm.
Does it
Either
have to
am
be
I.
this week?
I don't know how they post their meetings or hold them. I know they just came to the town clerk because I guess boards who don't have capability of posting like I do put a submission in through the clerk for their meeting. So she brought it to my attention along with the town administrator's attention that they were looking to hold it in person and Ryan wanted us to weigh in on it before she was allowed to. They were allowed to.
The
Well,
reason I asked that question is I think timing is everything, and it seems like this particular week has been just abominable with all the cases. Today we had, I think, over 1,000 cases reported, or with 210 deaths.
We've been pretty consistent with over 1,000 a day, it seems like, for the
Right.
last week and a half.
So if it could be delayed until things calm down a bit, I'd feel better about it. But if I have to
Yeah.
err, I'm going to err on the side of caution because I think Kathy said it right. We're in a situation that's really not favorable for these kinds of these get-togethers, and
Mhm.
I have my second thoughts about it anyway.
well, think of it this way. They just brought you can't even have your family over for Thanksgiving. You have to have 10 people. And then that's it in your house, right? I mean, so now they want to have a COA meeting, and they want to have more than 10, maybe. So how can that work anyway? They'd have to put a sign on the door that says, yeah, I mean, even though, yeah, you can, if the public wants to go, but they can't because the state says they can't do it.
Right.
So if they want to have 10, okay, but that's it. They have got to say no to everybody else if they want
Right.
to do it.
They
It
can't
becomes
say
the
no
same-
because of open meeting
It's
law.
public, open meeting law. So
Well,
so
then
they
I
end up
guess
having to be on
Then-
Zoom anyway.
Then
then
it's
you just
no.
can't do it.
It
Right.
just can't.
The 11th person walks in, they have to adjourn. That's all.
Right.
Yeah.
That's right.
Correct.
Yeah.
So
Unfortunately,
and if- oh, go ahead.
there's a lot of things that I know that people don't like meeting on Zoom, but there's a lot of things that are going on that everyone doesn't like, and we just have to do it. It's a vulnerable population that would attend the senior center and the events there, and it's just not safe. I don't think it's not safe.
So
No.
I make a motion that we are not going to allow them to have an in-person meeting in that room this week. If the elementary school is closed all of the week of Thanksgiving, potentially they could have an in-person meeting at the gym at a later date where everybody can be very well spaced out, but they can't, they have to do Zoom this week.
Yeah, or in the cafeteria, but
They have to have a Zoom meeting.
yeah. Yeah, because I was of the understanding this was just basically an officers meeting. And if it's not just officers only meeting, then that's no,
Yeah.
no.
I agree with you, Judy. It's the benefit of this meeting doesn't way balance with the public risk if they're inviting the
Correct.
public in, period.
And I mean, if anything, we've seen from the super spreader events that it doesn't take much.
No.
You know,
Yeah.
we watched the cases from Fitchburg go from 25 to in 2 weeks over 200 and 80 businesses affected, and it's just getting bigger and bigger and bigger.
Mhm.
And we
Yeah.
don't want that. on
Melanie
our-
made an excellent point, and I think it would behoove us to also include a good rationale with our decision, which we all seem to, although not formally have made, can agree upon. And that is, this is a very vulnerable population. And I think that it's almost irresponsible to give the green light to that, because of all the folks in town that are more susceptible, you know, it's this age group. So it's a little disconcerting to me.
Yep. So there is a motion on the floor. Do we have a second on the motion on the floor?
Second it.
Okay. And I'm assuming we're all in favor, but Colleen,
Yes.
Ben,
Yes,
Judy,
Yes.
Kathy,
Yes,
and Kate, yes. So
Zoom
Zoom it
only.
is.
and
So
then the
they'll
other,
not be happy with this, but you know, what can you say?
Hey,
I guess if we were making everybody happy, we wouldn't be doing our jobs, right?
Healthy is the goal, not happy. You can be one. You can't be both.
I think I'm going to use that next time when my daughters complain about me not being the fun mom that lets them sleep over girlfriends' houses right now.
Mhm.
And then the other, I sent the email out about the trailer on oh my gosh,
Yes.
street name is just completely popped out of my brain.
Yeah, on Underwood Road.
Thank
Up-
you.
I can go up there. I mean, that's just up the street, you know.
Yeah.
Up the street
So
and
I-
around the corner.
I did let our CEO know about it as well. I think that if they wanted to come to the Board of Health and ask permission, our state sanitary code says anything that's there for more than 30 days, no one can give me an exact date of when it was placed, needs to be permitted through the Board of Health. So if they plan on having it more than 30 days, I guess we just invite them to come to a Board of Health meeting.
So I have a question. So far, what has been sent to me is the town bylaws,
Yep,
the zoning bylaws,
yep.
MGL, but I haven't seen an updated version of the Board of Health regulations. I was hunting earlier tonight, and I know I have an old copy left over from about 15 years ago. But I put it in a safe place, and I can't remember where that's at. But I will find it. But anyway, do we have, a recent copy, like within the last 2 or 3 years, an updated version of Board of Health regulations? Because all MGL says temporary housing needs permission from the Board of Health, but it doesn't define temporary housing. It doesn't say, if it's on wheels, is that something different from something that's on the ground, like a little cabin or something while you're building your house? Or what is the definition? MGL doesn't go that way. So
I sent over, did you get the link to the sanitary code that I sent over?
yeah,
Because
that's what I was reading.
in that, it says temporary housing means a tent, mobile dwelling unit, or any other structure used for human shelter, which is designed to be transportable and which is not attached to the ground or to another structure or to any utility system, which is on the same premise for more than 30 days.
So we'll have to, when I go up, I'll take a look and see if it's on wheels.
Yeah, it sounds like it's just a camper.
Yeah.
and therein is another distinction, because the zoning bylaws that we have address mobile homes, but as a registered vehicle, it falls under a different set of regulations.
But
It's
my
a
understanding
mobile home.
This is an Airbnb rental, is it not?
It's just a camper that people are using while they go hunt these 80 acres.
But is it privately being used by invitees or is it posted publicly as a lodging?
No,
I like Googled the number to see if I could find like a Craigslist ad or something, and I searched Craigslist and I couldn't find it. It just sounds out like there's multiple people coming in and out of it. So, I mean, I really don't care which way it goes. I was just presenting it to the board because the complaint came through to the office.
Yeah, I was curious because there are specific checklists in place
Right.
for anything that is considered a lodging. And if
Yep.
it's being rented through Airbnb, then it falls under two. It's going to fall under the temporary housing essentially and a lodging. So
but if it's being used as, and this is the scenario it kind of sounds like, is like, it's like an ice house. You go in, you use it to warm up. So you're out there hunting, you go and you use it to warm up, but you're not staying there overnight. So is that temporary housing? That's why I was hunting for more specific,
Right.
like usage and all that other stuff.
Well, they
So-
could be staying there overnight, though, because when you go hunting, you go early in the morning. So there is a possibility that they are staying overnight in that camper, but
Well,
It
what was
sounds
the
like what you
resolution?
said.
possibility.
What was the resolution that we had on Gardner Road at the Wilbur's place where we had all winter long, somebody with a wood stove living in a recreational or a camper? Did we ever
And that-
resolve that?
No, and that's what the building inspector, Rick Geronimo, brought up to my attention too, is there's still smoke coming out of there. So he actually stopped in and spoke with the person and got some pictures. So the building department is going to be stepping in on that as well, but Board of Health is probably going to have to get involved once we get their report or official complaint.
Wilbur's or the Underwood Road?
Wilbur's.
Okay, but on the
Yeah.
Underwood Road, I mean,
Underwood
we're
Road,
treading on a situation where if I park my camper out there, it's a registered motor vehicle, I put it in my yard and I let my buddy come up and stay in it. I don't look at that as any violation of sanitary codes, and maybe it wouldn't even apply under the sanitary codes.
So
This
I
is
guess,
it's I'm sure this is a real temporary thing because hunting season is only a few weeks.
Yeah, right.
This is just, I know when up in Maine, we have a camp up there and we rented a trailer out to a bunch of guys that wanted to go hunting for 2 weeks. And they lived, there was like 2 or 3 of them. They lived in the camper on the property and they, had heat and they brought their own food in and they slept there. Now, of course, this is Maine, this isn't Massachusetts, but, and it all worked out fine. I mean, and they were friends of ours, so we knew them. This could be the same situation. This could even be family.
right.
Yeah.
I think it just needs an initial investigation. Because right now we really don't know, and there's a lot of hypothetical. It's just that if they plan on having it there because it is a mobile dwelling unit, they just need to come before us and, kind of let us know, hey, we're going to be here and this is our plan. And we kind of say yay or nay. And, at least we have it on record that we got the complaint, we addressed it, and it's in our records for future.
Except that it's not a mobile dwelling unit. It's a recreational vehicle. There's a distinction. A mobile dwelling unit is something that drives up and somebody lives in permanently for a certain time. And on a recreational vehicle, I mean, they could be gone by the time we got there because they drove away. They have a license
Sure.
plate on it. And I
So
think
also, the definition also includes a structure used for human shelter.
but this isn't a structure, Mallory. This is a vehicle.
I mean, I guess you could go that way, but
My question, Mallory, is the phone number, is that of the
that's
complaint?
the owner. Yep, that's the owner of the property.
So we need to find out more. It looks
Yeah.
like.
Is
So
this an anonymous complaint, by the way?
Yeah, the person who called, it was on a voicemail. So I just, my job is to report it to you guys. So I got the information from the voicemail and reported it over. So basically as an admin, I'm not really tasked with doing the investigation. I'd be more than happy to make the phone calls, but I didn't want to overstep my boundaries. So, whoever felt it was enough of concern to bring to our attention, that there's been a trailer there. So
Gotcha.
just
Well,
wanted to bring
I'll
it to you guys
drive
and
up
what you do with it.
tomorrow. I'll drive up tomorrow and I'll walk it and see what's happening. Maybe I'll even find the neighbor that complained.
Make sure you wear orange.
Yeah,
Yeah.
yeah.
It is bow hunting season. There
Yep.
will be hunters out, so wear a bright color.
Yep.
I have
maybe we
my
just need to
MRC my MRC vest has bright yellow stripes on it, so
There you go.
Good. Any other topics to bring forward?
I have a very brief one. I hope it's brief. The door to the office for Valerie and for Lori has a broken doorbell. I would like to see that doorbell repaired. I think we have it in our budget to pay for the repair of a doorbell so that people can ring it and the door can stay closed until, it's heard and makes it. So I'd like to have Mallory look into, having it getting it fixed.
Wouldn't that be a facilities situation? Why should we pay for it? I mean, that's a town piece of property.
Okay, however it goes, Vin.
Yeah.
If you go facilities and if
Yeah.
their funds are dried up, then let's get it fixed.
Yeah, so that's technically the library trustees. So I'll bring it to the librarian's attention. Maybe she has it in her budget. And if not, maybe she goes to Ryan. I'm not sure how any of that really works because I know we can't like make alterations or paint or anything like that without their permission.
Well, worst case, I'll gift you a ring for Christmas.
Ooh, there we go. I mean, banging on the door has worked thus far.
I pull up to the driveway and call Mallory. That's what
People
I do.
have been able to find us when needed.
But
Last thing I had would be a follow-up on the request Bella had for a transfer plug. Do we have any information on that?
I did not get a hold of the Ken who had done the previous work, the electrician. I haven't gotten a hold of him.
and I have an update on under unexpected subjects. I've been researching fees in the Board of Health in terms of authority to, draft fees, review fees relative to administrative charges. I have one open question that I actually submitted to Ryan for his input. When I hear back from him, I'll put it together in an email and send it to everybody in the board so we can review it in the next meeting. But there's a really good draft that somebody put together from Northampton, Mass. That outlines specifically citing all of the legal backup, the reasons why boards of health have the power to set fees within the statutes of the town bylaws. So I'll send that all along once I have my final question answered from Ryan, and we can review it the Tuesday after next.
Sounds great. Thank you.
It was fascinating reading, I have to tell you.
Was.
Good thing I'm a fast reader, Vin. That's all I have to say. Speed reading. Best class I ever paid money for. Speed reading.
No, I'm not. You use the word fascinating. You didn't use, no matter how long it takes you.
No, it really actually was. There's a whole bunch of legal citations. I actually cross-referenced a bunch of them to see what they were about and how they were resolved. So it's come up quite a bit with specific.
No one has a good answer to it.
Well, this document goes a long way to giving a good answer. And the
Good.
answer is
Indeed.
essentially we can set fees and whatnot as long as we don't override fees set by the state around certain things like Title V, like they have a limit that they set. We have to work within those limits. We can override existing fees once they're put in place. So we can overhaul existing fees once they've been approved and upgrade them to keep up with like cost inflation and administrative service costs. And then it seems that the only thing barring anything is if there's anything within the town bylaws that specifically states that fees have to be approved by a third party within the town. But there's legal case documentation that says that there's actually they don't have jurisdiction. So the bylaws do hem us in to a point if they're there. But I read through our bylaws and I don't see anything to that effect that says specifically we couldn't do that. And then, barring that, anything in the town charter would override anything in the bylaws. So and nothing is there. So it seems that once a set of fees has been approved, we can increase them. Adding a new fee requires that we basically just take it to town meeting or city or to the Board of Selectmen. But it's more of a courtesy in a lot of cases because we have legal provisions within the state law governing boards of health to do so.
Well, that's good.
So it's pretty interesting. But the only thing that we can't change is set fees set by Board of Health and EPA around sewer assessment and specific betterments that they set the rate.
The only ruling I can recall that was made on fees in town was the select board about 5 years ago ruling that no board except them could waive a fee.
Ah, gotcha.
Yeah, so.
I have heard that, correct. And seen that, the waiving of fees. But that's also funny because in essence, the Board of Health waives fees, and this is another legal argument that I read about, whenever we choose not to find somebody who's in violation of some specific health ordinance. So
They call that a fee, huh?
well, it's a fine. So we have we actually have choices that are made there. There are certain things we can actually, fine for. We can choose not to fine people. We can choose to waive a fee for an individual on a case-by-case basis under a variance. We just have to actually hear it as a variance and then take a vote on it. And it's considered a variance to the public process under Board of Health law. It's very interesting how it's very nuanced. And I was like, wow, this is fascinating. So anyway,
Yeah,
I'll just
it's interesting context with way, and the fights I'm sure are very interesting too, with one person saying, arguing against this and that.
oh yes. And
Right.
in this process, do you know what I learned? Paul Revere was a member of the Board of Health, the first Board of Health in Boston.
He was.
Interesting.
He joined, he helped create it because of the refuse.
Offal.
Yeah.
Refuse and offal.
Thank you. Yeah, I'm trying to think of the fun word.
Yeah, I hadn't seen the about page for the Mass Board of Health in a while. I usually just dig into their archives, but I went to their homepage and it was listed as a fun fact there, and I was like, who knew?
Yeah.
Kind of neat.
The British are coming. Take your trash off my lawn.
I don't think people realize how independent the Board of Health is.
Right.
I remember when I went to one of those Mass Association Boards of Health meetings, and they were talking about how the Board of Health had the selectmen were trying to override what a decision by the Board of Health, and they actually took it to court. And the selectmen lost because the Board of Health is got a lot of independent power and a lot of legal standing that and other boards don't have some of these special privileges, and they actually stand alone so that the boards cannot override what a Board of Health decides on.
Right. The idea is that if the select board members happen to also all be the main business owners in town, they can't describe regulations for the Board of Health and override them in any way, shape, or form in regards to public health specifically. But the litmus test seems to have been consistent in that you have to have the ability as a board to prove a risk to the public safety or health, and that whatever you're doing is in line with that within a reasonable limit. Like it's just a reasonable test. But yeah, so more to come on that. Any other unexpected subjects? Going once? All right, hearing none, I'll make a motion to close the meeting at
I
8:24.
second it.
Kathy's a second. All in favor?
Aye.
Aye.
Yes.
Ayes have it.